Friends, I am Dr. Amdekar. In the last set of 7 videos, my colleagues discussed several issues related to speciality symptoms. Friends, we all know that majority of the speciality symptoms are first reported to a generalist, and hence we must have a clear idea about the basics of the speciality symptoms and also must know what better care the specialist can offer to such patients. In the first video of this series, Dr. Chokani discussed about skin rash and he emphasized that a skin rash could be the first manifestation of a life-threatening disorder such as meningococcemia or maybe a rickettsia with a gangrenous patch or even a purpuric spots of an acute leukemia. He also said that some of the diseases could be having a probability of life-threatening complications such as Kawasaki disease, which is going to be probably the most common acquired cause of myocardial infarction even in young adults. Once we know that the problem of skin rash is not likely to be serious, one considers not only the morphological characteristics of skin rash, the way it has spread, the sites which are involved, itching or not itching, and besides that, any accompanying symptoms which often give a probable cause such as infections, often viral, but also allergic disorders and sometimes autoimmune disorders. Having discussed skin rash as an important problem for generalists and often would need referral to a specialist, Dr. Anjali Gokarna talked about hearing impairment. Friends, hearing impairment is not easy to pick up clinically, and today we know that it has been a part and parcel of a neonatal screening, and the autoacoustic emission OAE test can almost screen the probability of a hearing impairment right at birth, which could be due to either a congenital or familial hearing impairment or may be related to some brain damage. Subsequently, of course, the recurrent otitis media is often a cause of hearing impairment, and as the age advances, large number of senior citizens do develop some hearing impairment, and one may have to suspect because of the person having started to talk a little loudly, one may have to consider testing for hearing impairment. Early diagnosis of hearing impairment is very, very important, and a proper referral for a hearing test as well as a subsequent management is important. Thereafter, Dr. Palni Raman talked about ear discharge, and he made a strong plea that an acute otitis media should be diagnosed or suspected even before the drum bursts and an ear discharge with pus comes out. It is very clear now that any acute upper respiratory infection with severe earache beyond the age of 2 years is almost always viral and does not need antibiotic. But if such a situation occurs in infants or in children under the age of 2 years, it is much rational to start an antibiotic. But recurrent otitis media is not uncommon. It needs a well review of complications, immediate complications such as intracranial infections or even tetanus, and of course a long-term hearing impairment. The causes could be a poorly treated otitis media or any foreign body or a granulomatous lesion or even diseases like tuberculosis or immune deficiency can present with recurrent otitis media. Having discussed these 3 common conditions to which we all generalists must be very, very aware of an early diagnosis, Dr. Tushar Maniar discussed about the sleep problems which are often totally ignored and overlooked. Friends, large number of us in our country are sleep deprived. There are problems with insomnia. People can't get to sleep properly. They are very restless in sleep, either because of stress, anxiety, like a restless leg syndrome, or even could be due to obstructive sleep apnea, maybe a large adenoids obstructing the upper airways, or an asthmatic condition, or a cardiac disorders, and so on and so forth. Today we all know that a good 6 to 8 hours of sound sleep is an important prerequisite for a good physical and mental health, and sleep problems are often overlooked by the patient themselves, and it is a good idea that we as a good rational and excellent doctors start inquiring about such hidden problems with every patient whom you see for whatever reason you can be. Having discussed several sleep problems, thereafter Dr. Khare discussed about the squint. Friends, squint could be again congenital or familial. It could be a result of a brain damage at any stage of development, but it could also be due to refractive error. It's not a question of just a cosmetic issue, but if neglected, one may have to be aware that it could lead to the double vision, maybe amblyopia, or even a visual impairment. Friends, therefore, barring in the first 2-3 months of life, where a transient squint may be acceptable as within normal limits, but anything that persists thereafter needs an early referral for a proper evaluation. Of course, Dr. Khare emphasized that one must rule out a paralytic squint, which could be a result of an acute neurological condition, and it's very easy to make out with clinical maneuvers. After the discussion of squint, Dr. Tushar Maniar again dealt with a very common but almost always neglected problem, and that is the dental care. Friends, we all go to dentist only when there is a big trouble or pain, etc. But today, a preventive dental care is a part and parcel of a good upbringing right from childhood and throughout our life. We all know that we need to keep a dental hygiene, brush our teeth, but it's important that only the toothbrush cannot take care of the teeth or gums well, and we might have to also use our finger or maybe a tooth powder and see that the gums are well cleaned as well as the teeth are clean. Rinsing the mouth every time after a feed, and of course there could be many other areas of a dental care like malocclusion or an impacted tooth, etc. And again, this is an area where a generalist must be able to advise their patients for a timely referral to a specialist. Lastly, I came in to discuss hidden symptoms. Friends, I did make a mention that there are several hidden symptoms which patients themselves or parents of sick children don't ever report unless we upfront ask for them. And the most common is a misunderstood onset of the disease. Many times, a mild abnormalities in terms of loss of appetite, weight, or feeling tired or not energetic is often not reported, and a sudden development of a major symptom like a high fever or a severe abdominal pain is reported as the first symptom of onset. Unless we ask whether the patient was completely well prior to the onset of such a symptom, we will totally get misled in terms of analysis of diagnosis. I also emphasize that there are some common problems in the community at large, like say constipation or a sleep deprivation, or maybe a problem with the diet, micronutrient deficiencies, behavior issues. Depression is getting more uncommon, and we must make an attempt to analyze such a probability in every patient that sees you for whatever the reason of symptomatology. Finally, I also dealt with a hidden symptom of fear, anxiety, stress in the minds of the patient, which ultimately come in the way of a good recovery. Friends, we have come to the end of an analysis of symptoms, and we have dealt with almost more than 75 different symptoms, their genesis, their understanding, and I hope you have enjoyed all that. But it is time, before we move further, that we quickly recapitulate, and in the next 8 to 10 videos I plan to give you a take home messages of every set of videos that we presented to you. I hope you continue to spread this information to your colleagues. This YouTube channel is good for every kind of a doctor, every speciality of every system, and please spread this information and request people to subscribe for our channel. The next series are titled Lest We Forget, and the first of the series will be presented by Dr. Chokhani, and he will talk of medicine, think, science, and beyond. I hope you continue to be with us. Thank you.